Okay, we're going to look at CPR on a child now. Okay, so exactly as we did before with the adult, except we've got the sort of the scary situation of a child being down, injured, we don't know what's wrong with them, potentially not breathing, a scary sort of situation.
Yeah.
Okay, so as before with the adult, we're approaching with dangers. What's the dangers? Okay, so the danger could be a parent, obviously is going to be hysterical, could be a pet, a loyal dog will normally not want you to be anywhere near like a child or anything like that. So
Other children?
Other children, yeah. Crowds, people looking, they'll all be on their phones trying to get, a little glimpse of what you're trying to do. Okay, so just try and compose yourself best you can, and remember you're only trying to help. Okay, so checking for dangers. Response is the same. Hello, mate. Can you hear me? You okay? You open your eyes? Okay, so I'm getting no response. Okay, now's a good time to shout for help. Okay, like I said before with the adult, there's no set thing that you must do this in this order. Okay, if you want to get help straight away when you see a child down, then that's fine. Okay, so checking for responses. Hello, can you hear me? Can you open your eyes? I'm not getting anything. Okay, so again, like I say, looking in pupils is a good one. And if we can remember Pearl, so pupils equal and reactive to light. Okay, so we can have a little look at there. You can see if they're pinpricked or whatever. Yes, okay, so we've done that. So then airway, look in the airway, especially with children and babies, you're looking at swallowing things, and potentially if they swallow something or choked on it, they can go down and they could go into something called a respiratory arrest because they're not breathing. Okay, so that may have happened. If there is something in the mouth, if it's sticking right out, you can get it out fine, but the likelihood is it's not. You may be able to see it, but as I said before, we're not wanting any fingers in, trying to pull it out. Yeah, so quickly, if we can, bring them over, do a log roll, try and get it out with a few back slaps. Okay, could be vomit, could be blood, could be anything like that, but I said, as before, you've got to get that airway sorted. So then we're doing a head tilt chin lift like we did before. Okay, in that position, listening, looking along the line of the chest, no more than 10 seconds. 9, 10, okay. I will then, on my phone, 999, bystander, I've got a child, unconscious, not breathing. Okay, so what's slightly different from an adult and a child is that you would give them 5 rescue breaths first.
Okay.
If you think you can, okay? Like I said before about infection control and COVID and everything else, it still applies, even if they're a child. So if you've got a face shield, that could go on. If you deem that I'm going to make that decision to do it, then fine. Okay, so it's 5 rescue breaths. Okay, so head goes back, pinch the nose. 5. You get 5 attempts like I mentioned before. Once you've done that, then you're on to CPR. Okay, so you want to give them a minute of CPR. Okay, if you're on your own, say, you would give a child a minute of CPR before you would run and get help. With an adult, you go and get help immediately. The child needs the oxygen more than the adult would, okay, because it's more likely to be a respiratory arrest than it is like a 40-a-day habit, okay, that's caused the heart attack. Okay, so as I said before, so I've done the 5 rescue breaths, so then I'm on for compressions. How many do you think, Ed?
Oh,
can you remember?
So it's 30.
30, good. So 30 compressions. So with a child, again, over clothes. So you're coming up, you're not measuring from anything, you're looking at the center of the chest, and you want to make yourself comfortable. Okay, you don't want to be in a difficult position, because as we did before with the adult, you could be there a long time. Yeah. So we're in that position. You can use one hand. It says in a lot of first aid courses use one, but make yourself comfortable. You can determine the pressure that you put on. Center of the chest, locking the body in this position, and then 30 compressions. So remember, the compressions are probably the most important thing. So if anyone's now talking to you, trying to say, have you called the ambulance or whatever, then just start again. Okay. 30. pinch nose, head goes back, 2 breaths.
So 5 at the beginning,
Yeah.
and then it's 5 compressions, 2. That's 2.
So 5 breaths, yeah, then 30 compressions, and then 2 breaths.
5:32.
Yeah. So once you've done the 5, forget about it.
Okay.
Yeah. So that's your initial attack.
So why do
Give
you,
them 5 rescue breaths.
is that because it's more likely to be a respiratory issue than a heart
Exactly
issue? Then?
right.
So it's important to get the oxygen in. That's what they need.
Exactly right. That's especially prevalent for a child or a baby, and in fact a drowning. So somebody that has drowned, that includes an adult. You get them out, do a little bit of postural drainage first if you can. So you're going to bring them towards you because their lungs and everything could be full of water. So let's get that out best you can. Remember what I said about the airway. And then 5 rescue breaths, and that's for an adult, child or baby.
And so-
That's only for drowning.
In terms of the CPR that you've just done,
Yeah.
what would be the cut-off age? Would you do it on size or age?
It's age. So when we do the baby in a second, so that's up to 1 for an infant, and then you've got 1 to puberty for a child.
Okay.
But as children are getting a lot bigger, so especially with an AED, when we go through the defibrillator, it's normally done on size now. Okay, so if you've got a very big child, okay, then you can use your sort of common sense and then treat them as an adult.
Yeah. Okay.
Yeah.
So that's about you in that moment, kind of choosing to make that call. And
Exactly
obviously,
right.
like you said, chances are with a child it is respiratory, so those breaths are so important.
Very, very important. Yes.
Okay.
Good. Happy with that?
I think so.
Right, Ed.
Yep.
You have a go then.
Okay.
Excellent.
Okay, so check for dangers.
Yeah.
Da, 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 da. I'm going to do my rescue breaths first before I shout for help. Probably would suggest.
Exactly as I said before, it's not a set thing. If you wanted to do that in that situation, then you can.
If I was to go with my gut, I'd probably be
Yeah.
like, Jamie, I need some help. I think
For sure.
Jamie, I
sure.
need some help. There's a child
Yeah.
down. So I'm
Absolutely
going to
right.
check for breath. So I'm going to check
Yeah.
that.
Yep.
1, 2, 3, 4, 5,
It's a good
6,
position, Ed.
7, 8, 9, 10. Jamie, can you call that ambulance, please, mate? There's a 7-year-old unconscious, not breathing, and
Excellent.
I'm doing CPR. So I'm
Okay.
going to do my pinch my nose,
Yeah.
chin back, 5 breaths.
Fantastic.
And I'm going to do
Good.
30 compressions.
Okay. That's good. So down 5 to 6 centimeters, or a third of the diameter of the chest. It's got to be effective CPR. I know it's a child, but you don't want to be not doing enough. Okay. So 100 to 120 per minute. That's good, Ed. Very good.
Safety.
Fantastic.